How do doctors diagnose asthma versus COPD? Imagine trying to solve a mystery where two conditions look very similar but have different causes. That's what doctors face when diagnosing asthma and chronic obstructive pulmonary disease. Both can cause trouble breathing, wheezing, and chest tightness, but their stories are quite different. Understanding how doctors tell them apart helps ensure you get the right treatment. When a person visits a doctor with breathing issues, the first step is usually talking about symptoms and medical history. The doctor asks about when symptoms started, how often they happen, and if anything triggers them. They also ask about smoking habits and exposure to lung irritants. During the physical exam, the doctor listens to your lungs with a stethoscope to check for wheezing or other abnormal sounds. Next comes a key test called spirometry. This test measures how much air you can blow out and how quickly you do it. For asthma, the lung function often improves after taking a bronchodilator, a medication that relaxes airway muscles. The doctor repeats the spirometry test after giving the medication to see if your breathing improves, which suggests asthma. In contrast, with chronic obstructive pulmonary disease, the airflow limitation is usually not fully reversible, even after using a bronchodilator. Doctors also look at the pattern of symptoms. Asthma tends to cause episodes or attacks that come and go, often triggered by allergies or environmental factors. Symptoms may improve between episodes. Chronic obstructive pulmonary disease, however, usually causes a steady decline with persistent symptoms that worsen over time, especially in older adults who have a history of smoking or exposure to lung irritants. Sometimes additional tests are needed. Chest X-rays can show lung damage or other issues. Blood tests, like arterial blood gas analysis, measure oxygen and carbon dioxide levels in the blood, helping assess how well the lungs are functioning. Getting an accurate diagnosis is essential because treatments differ. Asthma can often be controlled with inhalers that reduce inflammation and relax airway muscles. Avoiding triggers is also important. For chronic obstructive pulmonary disease, quitting smoking is the most effective step. Medications like bronchodilators and oxygen therapy help manage symptoms and improve quality of life. In the end, doctors relying on a combination of medical history, physical exam, spirometry results, and sometimes additional tests to tell asthma apart from chronic obstructive pulmonary disease. This careful approach ensures you get the right treatment and breathe easier.